Hello everyone, I am Dr. Aditi Jadhav, Junior Resident in Radiology from Bharati Vidyapeeth Pune. Today I'll be presenting our study titled Predictive Value of Shear-Wave Elastography in Splenomegaly, a cross-sectional analytical study. This work was conducted under the guidance of Dr. Priscilla Joshi ma'am and Dr. Samar Chatterjee sir. Splenomegaly is a common radiological finding encountered in daily practice and can be seen in a wide variety of conditions such as infections, hematological disorders, infiltrative diseases, and portal hypertension. Conventional ultrasonography plays a key role in detecting splenomegaly and accurately measuring splenic size. However, it offers limited information regarding tissue characterization. This is where shear-wave elastography becomes relevant. Shear-wave elastography is a non-invasive imaging technique that quantitatively measures tissue stiffness, which can reflect underlying processes such as fibrosis, congestion, infiltration, or inflammation. While splenic stiffness has been well studied in the setting of portal hypertension, there is limited data on whether elastography can help differentiate various causes of splenomegaly. The aim of our study was to assess the predictive value of shear wave elastography in patients with splenomegaly. The objectives were to compare splenic stiffness values with normal reference values, to correlate splenic stiffness with different etiologies, and to evaluate shear wave elastography as an adjunct to routine ultrasonography. This was a hospital based cross sectional analytical study conducted over a period of 18 months. We included 150 adult patients in radiologically confirmed splenomegaly. Ethical committee approval was obtained and informed consent was taken from all patients. Imaging protocol. Ultrasound and shear wave elastography were performed using convex probe 1 to 6 MHz on GE Logic 40 system. Patients were examined in the supine or left lateral position. For elastography, the region of interest was placed approximately 2 centimeters below the splenic capsule. Care was taken to avoid vessels and focal lesions. Five valid measurements were obtained, and the mean stiffness value was recorded in kilopascals. Statistical analysis included mean and standard deviation, percentages, and t-tests or ANOVA, with a p-value less than 0.05 considered statistically significant. Results are the mean age of the study population was 42.6 years with a standard deviation of 13.4 years. The etiological distribution of splenomegaly was as follows: portal hypertension 32%, hematological malignancies 21.3%, infections 18.7%, congenital and hemolytic disorders 14.7%, infiltrative and storage disorder 13.3%. On analysis of splenic stiffness values, we observed that portal hypertension showed the highest median splenic stiffness. There was a statistical significant association between splenic stiffness and underlying etiology with p-value less than 0.05. The highest splenic stiffness values were observed in patients with portal hypertension. This can be explained by chronic venous congestion, increased intrasplenic pressure, and vascular remodeling over time. Patients with hematological malignancies and infiltrative disorders showed moderately increased stiffness, likely due to cellular infiltration and tissue deposition. In contrast, infective causes of splenomegaly showed relatively lower stiffness values, possibly reflecting reversible inflammatory changes rather than permanent structural alterations. Our findings are consistent with previously published studies, particularly those evaluating splenic stiffness in portal hypertension. To conclude, shear-wave elastography is a reliable and non-invasive tool for quantitative assessment of splenic stiffness. Splenic stiffness varies significantly with etiology. The highest stiffness values are seen in portal hypertension. Shear-wave elastography can serve as a valuable adjunct to routine ultrasound in evaluating splenomegaly. However, larger multicenter studies are required to establish standardized cutoff values. Key take home messages are: shear-wave elastography adds functional tissue characterization to conventional splenic ultrasound. Splenic stiffness reflects congestion, infiltration, and fibrosis, not just the size. Portal hypertension shows maximum splenic stiffness. Shearwave elastography improves diagnostic confidence but should always be interpreted with clinical correlation. Thank you for your time and attention.